First question: what is the bioavailability of a drug given by intravenous route? 100%. Next, which drug causes blue line on gums? Which drug causes blue line on gums? Lead compounds. So lead compounds deposited as lead sulfide produces blue line on gums. Next question. Can emetics be given in case of poisoning due to corrosive substances such as acid, bases, kerosene, furniture polish, etc.? The answer is no. It will cause more harm to patients. Next question is, what is universal antidote? So universal antidote is basically a mixture. It contains two parts of burnt toast, one part of tannic acid, which can also be substituted with strong tea, one part of magnesium oxide. And this universal antidote can be used for emergency purpose, especially when activated charcoal is not in present in hand. Then we can use universal antidote. Next question: is it advisable to administer activated charcoal and ipecac at the same time to a patient case of acute poisoning? Activated charcoal and ipecac. The answer is no. Activated charcoal will absorb ipecac and prevents its emetic action. So basically activated charcoal will neutralize the ipecac emetic action. So the patient will have no benefit from it. Next question: what do you mean by quantal toxic response? So any quantal response means all or none response. That is, either the toxic response will be manifested or it will not be manifested. So that what is meant by quantal toxic response. Next question: who introduced the concept of therapeutic index to illustrate the margin of safety in drugs? Paul Ehrlich in 1913. Next question: what type of drug interaction takes place between oral iron preparations and magnesium trisilicate? Now see, magnesium trisilicate is a very, it is a constituent of the antacid preparations, oral antacid liquid preparations, which is the most common thing. And oral iron preparations, what is the interaction between them? Reduced iron absorption. Next question: what is the risk factor for patients taking both PAS and aspirin? PA stands for para-amino-salicylic acid. So let's see. Salicylism or salicylic toxicity. What is triple marker test used for? Triple marker test is used for Down syndrome, diagnosing the probability of Down syndrome in pregnancy. Next question is, what are rectal atropine suppositories used for? So rectal atropine suppositories are used for false uterine contractions, or which are also known as Braxton Hicks contractions. So this actually contains two questions. If anybody asks what are false uterine contractions, or that is, it is Braxton Hicks contractions. Next question is, what is pica? Pica is a compulsive eating disorder where people eat non-food items. For example, dirt, clay, flecking pens. I particularly know some of my friends do that. They have this pica syndrome. Next question is, what are teratogenic drugs? So teratogenic drugs are those drugs that are taken by pregnant mothers, and they usually disturb the development of embryo or fetus. Sometimes it can be dangerous to even halt the pregnancy, or they produced birth defect in the newborn baby, that is, they produce congenital malformations. These are teratogenic drugs or teratogenic agents. So what are the different classes of teratogens? So basically teratogens are classified into four types. This includes the radiation, any sort of gamma radiation, maternal infections, where the infection from the mother is spread to the fetus, toxic chemicals and drugs. Why was thalidomide withdrawn from market? We all know about this thalidomide disaster. So, because thalidomide was found to cause phocomelia, that is silt limbs. That is why it was withdrawn from the market. Next question is, what are the teratogenic adverse effects of tetracyclines? The answer is discolored and deformed teeth and retarded bone growth. Next question, what are the teratogenic adverse effects of indomethacin and aspirin? Means they both have the same type of adverse effect, teratogenic adverse effect. Let's see the answer. Premature closing of ductus arteriosus, which can lead to progressive right heart dysfunction, congestive heart failure, hydrus fetalis, and intrauterine death. Next question is, what is fetal valproate syndrome? Is a very rare condition caused by exposure of fetus to valproic acid or sodium valproate during first trimester of pregnancy. We know sodium valproate is the drug which is used for the treatment of epilepsy or epileptic seizures. So this, although this is a rare condition, this can cause. I mean, this do happens. So fetal valproate syndrome. Let's go to the next questions. Which part of the nervous system supplies to the skeletal muscle? The answer is somatic nervous system. Let's go to the next question. Which part of the ANS participates in conserving body energy? ANS means autonomic nervous system. Let's see the answer. Parasympathetic system. Next question. What are preganglionic nerve fibers? Let's see. Nerve fibers that carries impulse from the CNS to ganglion are called preganglionic nerve fibers. What are the effects of botulinum toxin? So botulinum toxins are poisonous neurotoxic protein which are produced by Clostridium botulinum, which is a gram-positive anaerobic bacterium and their related species. This botulinum toxin prevents the release of acetylcholine and causes flaccid paralysis. Next question. Bradycardia is caused by which action of acetylcholine? Muscarinic or nicotinic? And the answer is muscarinic. Let's go to the next question. What is the therapeutic use of bethanicol? So bethanicol is used in postoperative or neurogenic urinary retention. Next question. What is the biological source of pilocarpine or pilocarpine? So pilocarpine is obtained from Pilocarpus jaborandi family Rutaceae. Next question. What is cycloplegia? So cycloplegia is paralysis of the ciliary muscle of the eye resulting in a loss of accommodation. Because of the paralysis of the ciliary muscle, the curvature of the lens can no longer be adjusted to focus on nearby objects. So basically, you will not be able to see the objects that are nearer to you. This is cycloplegia. What is the therapeutic use of pilocarpine? So pilocarpine is mainly used in glaucoma for producing miosis and which is mainly for counteracting the mydriatic and cyclophagic action of atropine. Next question. What is muscarine? So muscarine is an alkaloid derived from the mushrooms Amanita muscaria historically, so that is why it is called muscarine. And it is associated with toxicity when poisonous mushrooms are ingested. So on eating of poisonous mushrooms, you can be affected by muscarine poisoning. What is the treatment for muscarine poisoning? Atropine, obviously. Next question. What is PSL syndrome associated with mushroom ingestion? Basically, you can also say what is the PSL syndrome associated with mushroom poisoning if you ingest poisonous mushroom. So the answer is humans with muscarine poisoning develop excessive perspiration, lacrimation, and salivation, so called PSL syndrome, within 50 to 30 minutes after ingestion. Next question. What are the therapeutic applications for muscarinic agonists? Now, a very few muscarinic agonists are actually used. So, let's see. So, pilocarpine and carbachol are used ocularly to treat glaucoma. They facilitate the outflow of aqueous humor, thereby reducing intraocular pressure. Pilocarpine is also used orally to treat xerostomia, which means dry mouth, and bethanicol is used to treat urinary retention. Next question. Why muscarinic agonists are contraindicated in asthmatics? Because they cause bronchoconstriction and increase mucus secretion. That is why they are contraindicated in asthmatics. Let's see the next question. Why muscarinic agonists are contraindicated in hyperthyroidism? Muscarinic induced hypotension reduces coronary blood flow, and body reacts to this hypotension by releasing norepinephrine. This is a very common reaction. Or muscarinic drugs, muscarinic agonists, they causes hypotension of the body. So the coronary blood flow is reduced. The body will naturally react to it by releasing norepinephrine, which will cause vasoconstriction so that the blood pressure can be maintained. And again, patients with hyperthyroidism are very sensitive to norepinephrine and can develop atrial fibrillation. So, being sensitive to the increased amount of norepinephrine that is being released, the patient may develop atrial fibrillation. That is why it is contraindicated in hypothyroidism, all the muscarinic agonists. Please do subscribe if you haven't subscribed to the channel and hit the notification bell. I'll be bringing more videos of this sort and other revision videos for you. Till then, have a great day.